As the second wave of the coronavirus ravages South Africa, Gauteng province has emerged as the epicenter of the deadly COVID-19 in that country. Gauteng is one of the most prosperous provinces in the country. Respondent Yelisa Injamela reports.
The Gauteng province is in the eye of the storm. At least that's how Premier David Makhura has described the situation. Hospitals in this province are becoming increasingly overwhelmed, with the second wave spreading rapidly. The Steve Biko Academic Hospital in Pretoria in particular has been battling an influx of COVID-19 patients over the past few weeks. This prompted the facility to erect tents in the parking lot. They also used other desperate measures to avoid turning people away. Despite those measures, the hospital still struggled to deal with the increasing numbers. Images of patients being treated in makeshift emergency units made the rounds on social media, with healthcare workers warning that the hospital has reached a breaking point. After the emergence of these pictures, the Premier made an urgent visit to the hospital and admitted that there's a pending crisis.
We are just where we were at the peak of the first wave, and we are passing that peak. All models are telling us that the second wave or the resurgence may be more than the first wave. That is something the evidence is already showing. In the last 7 days, admissions in public hospitals in Gauteng increased from around 700 in public hospitals to about 2,000 just in the last 7 days. If you combine public and private hospitals, the admissions are now about 4,000, about 4,500 admissions in Gauteng hospitals.
What is even more worrying is that coming from all those patients, the people that are sick around the first wave, the people that were sick and at the verge of dying were elderly people, and young people were recovering quickly. Some were not even having symptoms. Now the people that we are admitting are younger people. It's worrying.
Premier Makhura attributes the spike in COVID-19 cases to the return of holidaymakers from the December festive season. Some patients are coming from private facilities because of lack of space, while others are from other provinces and from the SADC region.
Given the fact that all the numbers are doubling up, we are gearing up for a difficult time, and that's why we are calling on citizens to continue to help us to support all these measures that are in place.
More tents will now be erected to cope with the increasing pressure in hospitals.